So there's a newly formed international watchdog coalition of includes doctors, healthcare experts, thought leaders, representing millions of medical professionals around the world, and they unveiled. So what's going on is doctors who originally were duped by the COVID narrative are now speaking out, and there's this organization, and they have these commercials. I'm going to show you one right now.
We are doctors saying what
tens of thousands of
silenced medical professionals
from all over the world
have not been able to say.
A sad realization progressively, they don't have our best interests in mind. They're not doing their job. They're captured, they're paid off, they're corrupt.
What we're seeing now, especially as a family doc, a lot of anxiety, PTSD. I've never seen so much fear, not only in our nation, but in the world ever.
Some of us are not afraid to speak out because we don't have huge bills anymore. Others, newly in practice, with a big mortgage and medical school payments, it's scary.
I think we need the truth. We need to investigate what happened here and how can we keep this from ever happening again.
We've lost our connections. We're all feeling connected through online communities, but that's not ever going to replace having face-to-face conversation and having a hug. There's power in human connection.
So let me bring in the founder of the Global Health Project. Dr. Kat Lindley is a Croatian-born, American-trained, board-certified family physician with a direct primary care practice in Texas, and she is the co-founder of the Global Health Project, a coalition of organizations, experts, advocates dedicated to improving, protecting the health and the future for all humans through education, advocacy, programs, and communication initiatives while defending health choice, equality, and responsibilities. Please welcome to the show, Dr. Kat Lindley.
Thanks for having me today.
So tell me, what led you to found this organization?
We realized that what happened can never happen again. And if you just watch, not really the news, but Twitter, if you listen to different stories, you can see the WHO is trying to pass the Accord Treaty. They talk about this new disease X. So we are probably another health emergency away from something happening, or climate change emergency, as we're seeing with these fires. So it's very important to start having conversations, see what went wrong. We know that patients don't trust doctors anymore, and we have to restore their trust back.
Well, when you say we can't let what happened happen again, what happened?
So this video that you share, it shows stories of 6 health professionals who kind of found their own truth in their own way. What they realized is the system itself is broken. The agency that we thought we can trust in actually were not correct, and they led us down this path where physicians started following the protocols, rules, and not really doing their own critical thinking to see what can happen and what can help our patients.
So you're talking about government agencies being captured by the corporations they're supposed to be regulating, right? You're talking about the FDA, you're talking about the CDC. Now, we've told that has that happened in other countries?
It has. The same thing has happened with MHRA in UK, with SAFRA, I believe they're in South Africa, and the Australian agency, I don't remember their initials. But all these agencies have followed the narrative. And the narrative was to tell our patients to stay home until they can't breathe and then go to the ER. Then the protocol started in the hospital. And then later on, the vaccines were introduced as this panacea for everything that's happened. And in the meantime, we did have other options that we could have offered to our patients. Some of us have, some haven't. But one thing that has been lost along the way is that when it comes to patient and physician relationship, the ones that we really should be serving and taking care of are the patients, and they have been lost in this whole debacle.
So people don't, you think there's a crisis with people trusting their doctors, or do you think there's a crisis of doctors not trusting the health organizations in their communities or in our country?
There's both. I would say for myself, I can just talk about myself. I realized early on that CDC was not to be trusted, and it actually started with the masks. Initially, they told us to wear full protection. They ran out. Then they went to N95. Then they went to surgical mask. They ran out. And at some point, CDC said to wear a bandana, which everyone knows doesn't make any sense. So some of us have seen this earlier than others. Then the same thing with the NIH, with the FDA. We started this narrative safe and effective until, no, it's not safe and effective, or it's not as effective as they're saying it is. It prevents the illness. No, it doesn't prevent it. So there is the story of the doctors coming to that realization. And then there is the story of patients who end up being abandoned by some of their physicians. They were scared, end up going to the hospital, put on a protocol. We had lots of issues with patients who now are scared to go back to the hospital because they feel that their wishes will not be heard. So the story is on both sides.
Well, we witnessed it, right? We witnessed the doctors being, well, even in California now, they passed a law to criminalize doctors for practicing medicine, for trying to figure out their own protocol to treat COVID. You're not allowed to do that. You have to do exactly what the state tells you to do, which is big pharma, because big pharma owns the government. They're corrupted. And so the state telling doctors what to do is big pharma telling doctors what to do. They passed that law here in California while our governor, Gavin Newsom, wags his finger at the Florida governor, DeSantis, like he's some kind of fascist. There's nothing more bigger fascist than our government here in California when they try to criminalize practicing. They did criminalize it. How do you push back against it? You're creating a coalition. It says here of coalition of organizations, experts, and advocates. So what does that look like? And then how do you push back so that this never happens again?
So we decided to go with the story of the doctors because we did actually research to figure out who has the voice, who the people want to hear from. We initially thought maybe they want to hear from the children, what has happened to the children during this pandemic. Then we thought, well, maybe it's the parents. And our research showed that it's really the doctors they still want to hear from. Because by sharing these stories of 6 health professionals who, like I said, realized what happened should not happen, the system is broken, they can't trust what they're reading in their journals. By seeing them going through that journey, people actually realize that it's okay that they feel the same way. It's okay for them to be asking questions and saying, this doesn't make sense. Because I would say, you have, like I said, the story of the doctors who believe the system, but also you have the story of just regular people who believe they're doctors. And now they realize, the whole thing is broken. We have to start all over again. And from my standpoint as a physician, this trust that we lost along the way just shows that now it's our job to restore it back. And the other part of this equation is a patient. Take charge of your own life. Don't just take everything you've been told for granted. If you have questions, ask, debate. Don't just accept everything as this sermon from the higher up. We need to have this conversation back and forth because it's going to happen again. We're another disease away. We're another emergency away from what has happened. And we can never allow for this to happen. Lockdowns, mandates, that's not the American way.
Well, and all the science now, again, proves that they were wrong to recommend masking doesn't work at the population level. Also, lockdowns have a negative effect. It actually created more health problems and created more death. And if you spoke up against those things in real time, like we did at this show, you were smeared, slandered. We got a strike for telling the truth about the vaccine from YouTube because YouTube, according to their guidelines, is I'm not allowed to say anything that goes against the WHO. Now, why they decided to use the WHO, I know why, because Bill Gates funds it. It's funded by Bill Gates. And so he gets to dictate. He's unelected. He never went to college. He never finished college. He's not a doctor. He doesn't even have a college degree, but that guy gets to dictate healthcare policy for the entire globe because he funds the WHO. People don't know this. People don't know that Bill and Melinda Gates Foundation and Gavi, which he also is the funder of, are the two biggest funders. When you put them together, it makes Bill Gates the #1 funder of the WHO, even more, gives more money than China. So I'm not allowed to say anything that goes against them. So this is how Orwellian our culture has gotten now, that YouTube, which is owned by Google, the richest corporation in the history of the world, which is in bed with the security state and the CIA and the FBI to censor people, are now doing it at the behest of the WHO, which is Bill Gates, which is a maniacal, diabolical billionaire. You know how you get to become the richest guy in the world? By helping people, right? That's how you get to be, not by squashing people like a megalomaniac, which is what he is. And because he dresses like a nerd and wears crew neck sweaters, people think he's a nice guy. The guy's a maniac criminal who crushes people for a living. And he's dictating healthcare policy, and he doesn't even have a college degree. He put $55 million into the vaccine, and then he made $500 million while everybody else had the lockdown directed by him through the everybody else had to lock down, which again went against all science. Nobody ever said do a lockdown in a pandemic ever before COVID. This was all new. And then he made $500 million, Bill Gates. And then as soon as he cashes in that stock, he starts talking about how bad the vaccine is and how it's not infection blocking. It's not long lasting. And we have to get better things. And the new thing we have to get is something that you inhale through your nose. Turns out he's invested in that too. And this is the guy who's running the healthcare through the WHO, a billionaire maniac. And so now people like you hopefully have realized it, like a comedian has. And you're now the medical professionals are going to somehow stand up against this so this doesn't happen again. Are you blowing the whistle about the WHO and their corruption and how they're run by a criminal in bed with terrorists in Ethiopia?
Yes, some of us are. And actually, everything you said is what I've been saying for a while. I've been following the pandemic, the amendments to the IHR and the pandemic treaty for the past several years. And I'm very vocal about what needs to be done. If you actually, anyone that follows me on Twitter knows that my favorite hashtag is exit the WHO. People get bogged down in these specific of Article 35, Article 7, 19, and all that. It doesn't matter. There's nothing good in there. Because that's exactly right. Our healthcare, our health actually has been hijacked by these global masterminds, whatever you want to call them, for their own political and financial gain. And the way you can push back as a regular individual is just say no. I know it sounds silly and maybe naive on my part, but just say no. Take charge of your health, take charge of your finances, take charge of your children's education, take charge of your faith. And then just push back and create your own community, your own relationships. And that's why we have to start this conversation somewhere. I'm not naive to think that we're going to solve all the problems, but if we at least restore some kind of trust between patient and physician, that means that next time something happens, you have someone you can trust to go to if you get sick, so that you don't end up getting sick or something worse happens to you. It's a first step, and there's going to be many more. But the power is in people. The power is in us. We just need to take our power back and simply say no. It starts with one word, no.
I agree with you 100%. You're supposed to. The reason why people used to say "my body, my choice" is because that's a value, that you value your bodily autonomy. And so you don't even have to get into the weeds about is abortion, when does life start. It's about bodily autonomy. And that's a value. And you can't have the state tell you what to do with your body, put anything in or take anything out or do anything with your body without complete informed consent to start with. That's from Nuremberg. Well, we didn't have complete informed consent. They wanted to hide the data for 75 years. And then they admit that they never even tested to see if the vaccine stopped transmission or contraction of the virus, which is the basis for mandates. So the whole thing was built on a lie. And the people who pushed back against it were we're still being smeared, still being called conspiracy theorists and crazy. Look what they say at RFK Jr. They just start with, he's an anti-vax conspiracy theorist, even though everything he said has proven to be 100% correct. And why are they saying that? It's because the people saying that get paid by Big Pharma. That the TV news is funded by Big Pharma to 75%. The reason why they fired Tucker Carlson isn't because he was lying. They fired him because he brought on RFK Jr. to tell the truth about how the news business is corrupted by Big Pharma cash. And then he also told the truth about Zelensky and Ukraine. And you can't do that, or they'll fire you. Just like I can't do that here, or I'll get censored. If I tell the truth here on YouTube about all those things, I will also get censored. And I will get a community strike, is what they call it. Anytime I tell the truth about anything, terrorism, the war, they demonetize the videos. That's their first thing, and they go, well, we don't want to advertise on things that about war. It's all garbage. But I really appreciate that you're doing this. The Global Health Project. Is there a way that regular people can get involved? Do you have a website? Do you have a call to action for anybody, or is it just to try to raise consciousness around the idea of always questioning? That was the craziest thing during the pandemic, is that you were not allowed to question. It was called don't do your own research, which meant just have blind faith in a guy on television telling you to do something. That's what they meant by trusting science. We all know you don't trust science. You question science. All right, I'll stop talking. You can go ahead and take it wherever you'd like.
So we have a globalhealthproject.org. You can download videos, share them, take them to your doctor, ask your doctor a question and say, if this happens again, would you treat me with medications that might not be approved, but they're actually safe? And, have the conversation with them, but then also share it with your friends. It has to start somewhere. This give and take has to become a norm for all of us. I grew up in communism, and I was extremely surprised to see that Americans pretty much rolled over and just said, sure, you want to take away my freedom? Here it is. It's not a big deal. I want to be safe. I don't want to be free.
Yeah. It was...
Now we have to.
Go ahead.
No, I was just going to say, now we have to actually, it's kind of postmortem of what happened. And the biggest thing that was lost during this time is we lost connections, these human conversations. And everyone is afraid because if you go to your family on Thanksgiving, you can't talk politics, you can't talk health, you can't talk this, you can't talk that. You have to just forget all that. It's nonsense. We're human beings, we're family. Everything is on the table and everything needs to be discussed because I have 5 children. What happened can never happen again. This is not the future I want for my children. I'm hoping that everyone agrees with that.
Okay, Dr. Kat Lindley, I really appreciate what you're doing, and I appreciate you making time for the show today. Good luck.
Thank you.
Okay, bye-bye. So I have to say this too about for YouTube, so just so you know that the vaccine is super safe and effective. Super. It's the best thing in the world. I take 3 boosters for breakfast every day, and it's also it'll help. While it doesn't stop you from getting COVID, obviously it doesn't stop. But it's supposed to slow the spread. That's what I'm supposed to say. And so I'm saying it. And it's supposed to slow the spread. And it'll keep you from being seriously ill, hospitalized, or dead. That's the real science from YouTube, you guys. Everyone knows that now. Hey, everybody, only $10 to go see my new stand-up special, COVID Lies Are Funny, at jimmydore.com. And come see us do a live show. We're going to be in Cohoes, New York, Hartford, Connecticut, Bakersfield, California, Baltimore, San Francisco, Huntington Beach, Rosemont, and Chicago, Las Vegas, Salt Lake City, and more. We're going to be in New York, Stamford, Connecticut, Pottstown, Pennsylvania, San Diego, everywhere. Go to jimmydore.com for a link for all our tickets.